Hi everyone, good day. This is Dr. Von. Welcome for another discussion sa ating laboratory. And for today, we will be discussing about your lipids. So this is now the laboratory counterpart discussion of your lipids. Actually, kakatapos ko lang ding mag-record ng carbohydrates. So I decided ituloy-tuloy ko na lang itong pag-record ng video para tapos na lahat. So for today, our reference handout will be your clinical chemistry of your Bishop, your Henry's, and your Tits, clinical chemistry and molecular diagnostics. So this is a combination of these different books. Pero majority of the discussion, I guess, nasa Henry's. And also, I will give you a laboratory package insert of the different tests for your lipid. So later on, mag-gets nyo ano yung ibig sabihin ng mga package insert, ano yung mga reagents, and everything. So, what's going to be our learning objective for today? At the end of this pre-recorded video lecture, the student will be able to, number 1, describe the laboratory tests used to assess lipids, your lipoproteins, including the principle and procedure. Dito, we will now be discussing what are the different type of tests for each types of your lipids. What are kasi meron tayong enzymatic, meron tayong chemical test. So we will discuss each one of those tests. Then, identify the reference ranges for the major serum lipids and describe the role of standardization in the measurement of your lipids and lipoproteins. So first, we will be discussing about the blood sampling and the storage of your lipids and lipoproteins. So what are the things that we need to consider when we do your blood sampling and the storage of your sample? There are different factors that we have to consider. Number 1, biological variation. When I say biological variation, that includes the age of the patient, because an increase in age would mean that there would be possibly increased cholesterol level. In terms of the sex, women have lower level than men. Seasonal, cholesterol will increase in winter. Dietary intake, restricted diet for 2 weeks. Medication such as your oral contraceptives may also affect the level of your cholesterol. There are a lot of different medical disorders. Again, you're already familiar with those medical disorders that will affect the level of your lipids. Then, of course, importantly, pag meron tayong sedentary lifestyle and other biological variation. Of course, if you have a recent MI, stroke, and cardiac catheterization, there will also be an effect to the level of our cholesterol. Food intake, daily intake of fat increases your cholesterol level. And also, in terms of different acute illnesses, it is recommended that lipoprotein measurement should be made no sooner than 8 weeks after any form of trauma or acute bacterial or viral infection, and 3 to 4 months after childbirth. Again, hindi ka pwede kumuha ng laboratory sample natin for lipid tests not sooner than 8 weeks after any form of trauma or possible infection. There are reasons behind that, and I want you to read your Henry's. Everything nandito to sa Henry's. It was very well explained sa ating Henry. So I want you to read on that part. Number 2, in terms of fasting, meron tayong for total cholesterol and HDL can be measured in your non-fasting individuals. Your triglycerides and your LDL requires fasting of individuals. So the ideal time should be 12 hours. So according to your NACP, your adult treatment panel 3, at least 9 hours. But always remember, should be the ideal of 12 hours. Bakit kaya ina-allow nila to at least 9 hours? To accommodate both the unable and unwilling to fast for 12 hours. Again, pag sinabi, you're already familiar with lipid profile. When we say lipid profile, that includes your total cholesterol, HDL, your triglycerides, and your LDL. Automatically na yan, yung magpapatest kayo ng, magpapalipid profile. Of course, these are now the important components of your lipid profile. That is why, Doc Von, kung lipid profile ako, magpapatest ako ng lipid profile, ano ba, i-require pa ba ako mag-fasting? Kasi nga naman, total cholesterol is non-fasting or HDL. Pwede bang non-fasting na lang muna, then magpa-fast lang ako later on? Of course, hindi. Since your lipid profile already include your triglyceride and LDL, and it requires fasting, automatically, dapat magpa-fast ka na talaga for your lipid profile kasi nga, na-include na yung triglycerides and LDL. And don't you worry, kahit na non-fasting or fasting or total cholesterol and HDL, it does not affect the laboratory result. Kaya nga, once automatically lipid profile, fasting agad. Pero kung individual testing for total cholesterol and HDL, usually non-fasting individual. Pero parang seldom lang ako nakakita na individual HDL. Kung total cholesterol, marami pa akong nakakita na yan lang ang pinapa-request. And we should allow for a non-fasting test for your total chole. Okay? In terms of posture, of course, it will also affect the level of your cholesterol result. Why? When standing patient reclines, decrease in 10% of your total cholesterol, LDL, and HDL. Why do you think? Bakit bumababa ang value ng TC, LDL, and HDL? Of course, sino bang medtech na kukuha ng dugo na nakatayo ang pasyente? Remember, proper collection of sample must be done. Dapat, di ba, nakaupo ang pasyente, hindi nakatayo. Di ba, ang hirap naman. Nakatayo, nakaganyan lang siya, tapos ikaw nakatayo. Ang hirap, mahihirapan talaga tayo. So, ano bang rationale dito? When a standing patient reclines, extravascular water transfers to the vascular system and dilutes non-diffusible plasma constituent. Therefore, decreases of as much as 10% of the concentration of your total cholesterol, LDL, and your HDL. Okay? Dapat proper way of collecting your sample. Position of the patient must be standardized for venipuncture. All the time, sitting position. Of course, hindi pa naman ako nakatry mag-venipuncture na nakatayo ang pasyente ko. I don't know ha, please do not do that. NCEP recommend patient be seated for 5 minutes before sampling, and remember, prolonged venous occlusion or hemoconcentration may increase your cholesterol by 10 to 15%. Again, to avoid such problem, we have to follow the standard way of collecting your sample. Now, the type of sample that we should collect for a specific tests, whether plasma or serum. So, when applying your Friday-Wald equation where LDL is calculated, you can request for plasma or serum. Either way, okay lang if you're doing your Friday-Wald equation. Later on, malalaman natin to what's your Friday-Wald equation. Plasma for ultracentrifugation and electrophoresis or your lipoprotein analysis. So again, what is the rationale why we use your plasma? Because your plasma samples can be cooled at 4 degrees Celsius and retired the changes occurring at room temperature. But remember, your plasma should not remain in contact with the cells overnight. Also, protein aggregation occurs less frequently using your serum. Doc, yung plasma naman natin may anticoagulant. Again, even in the presence of the anticoagulant, protein aggregation can also occur in plasma that is stored in the refrigerator for a few days or frozen for longer periods. So, this can make difficult to obtain a homogeneous aliquot for analysis and can interfere with the flow of your sample in the automated analyzers, resulting now into inaccurate or variable results. Therefore, protein aggregation occur less frequently using now your serum versus your plasma. Please take note on that. Also, the anticoagulant use. Pag blue tube, ano gani ang ating anticoagulant for that? It's your citrate. Your citrate will cause a large osmotic effects, will cause a falsely low result. So we have to avoid using your citrate. How about your heparin? Heparin, it can alter your electrophoretic mobility. So what is preferred is your EDTA because it retards certain kinds of oxidative and enzymatic alterations occurring in your lipoprotein during storage. But remember always remember that will also depend on the reagents na gagamitin natin. So may mga reagents na magre-require na you will use your plasma, you will use your serum. So magdedepende pa rin yan. But generally, your EDTA will be very beneficial because, again, it will retards your oxidative and enzymatic alterations occurring in your lipoprotein. Storage naman tayo. In terms of the storage, your total cholesterol, your triglycerides, and your HDL and your apolipoproteins can be analyzed with frozen sample. So take note, pag long term na store natin siya or more than 2 months, dapat nakastore siya at negative 70 degrees Celsius. Pag short term lang, around 1 to 2 months at negative 20 degrees Celsius. Again, frozen samples are not appropriate for ultracentrifugal analysis. Again, frozen sample will not be appropriate for ultracentrifugal analysis because your triglyceride-rich lipoprotein do not withstand your freezing. That's why hindi pwedeng gamitin for ultracentrifugal analysis. Please take note on that. Now, we will proceed to the different laboratory methods sa ating lipids and lipoprotein. These are the most common methodology that we employed in testing your lipids. So, let's first discuss your cholesterol. For your cholesterol, meron tayong tinatawag na chemical methods by Lieberman-Burkhard, your Salkowski, and your Abel-Kendall. So, these are the most common chemical methods for your cholesterol. Again, remember this guys And also, your enzymatic method. So, nade-divide ang laboratory methods for cholesterol, either chemical or enzymatic. Ngayon natin. First, let's discuss your chemical methods. For chemical methods, we have your Lieberman-Burkhard's test. So, what is the principle of this test? 2 mg of dry extract was dissolved in acetic anhydride, heated to boiling cold, and then 1 ml concentrated sulfuric acid was added along the sides of your test tube. So, what is positive for this test? Formation of your green color will indicate the presence of steroids. So, that's the positive green color. Pag Lieberman-Burkhard, dapat green color, presence of your steroid. Remember, steroid is cholesterol. These are made up of your cholesterol. Very good. We have also your Salkowski reaction. So, 2 mg of dry extract was shaken with your chloroform. So, to the chloroform layer, sulfuric acid was added slowly by the sides of your test tube. So, what is positive for this test? Formation of your red color indicated the presence of your steroids. Again, remember the test and the color reaction. Lieberman, dapat green. Salkowski, dapat red color. That would indicate the presence of your steroids. We also have your Abel-Kendall test. So, your Abel-Kendall, another chemical methods for your cholesterol. So, hydrolysis of your cholesterol using your alcoholic potassium hydroxide or your potash to your unesterified form. So, there will be extraction of your unesterified form with your petroleum ether, and then the measurement with your Lieberman-Burkhard reagent. So, this is a combination with your Lieberman-Burkhard reagent. So, again, anong composition ng ating Lieberman-Burkhard reagent? Meron tayong sulfuric acid, acetic acid, and your acetic anhydride. And then, since we are referring to a Lieberman-Burkhard, the positive result here will still be your green or your bluish green color that would indicate the presence of your cholesterol. So again, medyo chemical test, more of hindi siya quantitative, no? More of qualitative lang. It's either present or not. That's it. Now we're done with the chemical methods for your cholesterol. Now let's proceed with the enzymatic methods. Usually ito talaga yung mga ginagamit sa mga package insert. It's really a combination of your it's really your enzymatic method. So I want you to be familiarized with the reaction because later on pag discuss natin sa package insert, madidiscuss na naman natin to paulit-ulit lang talaga ang discussion ng enzymatic method. So again, how does your enzymatic method for cholesterol happens? Remember, anong advantage ng using your enzymatic? Your enzymatic method will use smaller sample volume, no preliminary extraction step, and it is rapid and precise versus your chemical method. So, anong nangyayari natin dito? Tingnan natin ha. Your cholesterol ester with the combination of water will be acted by your cholesterol esterase, forming now your cholesterol and your free fatty acid. Your cholesterol with the action with added oxygen, it will be acted by your cholesterol oxidase, forming now this product and your hydrogen peroxide. Of course, mas gusto natin yung hydrogen peroxide. Kukunin yung hydrogen peroxide, one of the reaction products, and it is measured by your peroxidase catalyzed reaction that will now form a colored dye, which is your sorry, di ko talaga ma-pronounce. I'm sorry, this dye, which will create a color reaction, and that will be detected by your device. So ito na yung magkwa-quantitate ng ating system, ng ating cholesterol level. So most common na ginagamit natin dito is your spectrophotometer. So later on, makikita niyo paano natin dinidetect. So, what are the interfering substances? Marami tayong interfering substances. Pwedeng plant sterol, ascorbic acid, bilirubin, and your sample turbidity, and as well as the presence of your hemoglobin, high levels of your hemoglobin. Your ascorbic, paano nakaka-interfere yung ascorbic natin at saka bilirubin? It's by consuming your hydrogen peroxide. So therefore, pag mataas ang level, mayroong presence ng ascorbic acid or mataas ang level ng bilirubin, it will consume your hydrogen peroxide, leading to false increase or false decrease of our result kasi kinukonsume yung hydrogen peroxide. And hindi yan madedetect masyado ng ating peroxidase. Mababa ang value. We're done with our cholesterol. We now proceed with your triglyceride. So, triglyceride, first is the chemical method. We have your CDC reference method. So, again, anong advantage ng ating CDC reference method? Advantage niya, it limits now your interfering substances. Mas mababa yung interferences ng different substances using your CDC reference method. So, ano mga test natin? We have your extraction of your triglycerides by chloroform. Then you isolate your triglyceride by your silicic acid chromatography and release of your glycerol by saponification. When we say saponification, ito yung alkaline hydrolysis of your triglycerides. Then this is actually similar to your Van Handel and your Silversmith method. And then, anong nangyayari? Your glycerol plus your sodium periodate will be reacted to form now your formaldehyde and your formic acid. And then, this formaldehyde is being produced and is measured by the reaction with your sulfuric acid solution of your chromatrophic acid to produce now your pink chromophore. So, the end product or the positive result will be a pink and color. Please remember that, again, ang pinaka-importante naman sa mga method is, ano yung mga names nila, ano ang principle, and what would be the test result for that. So that's gonna be your CDC reference method. Again, of course, we have a enzymatic method for your triglycerides. So, yung enzymatic methods ng triglyceride, masyadong marami. Pwedeng ganitong pathway ang dadaanan niya or pwedeng ganitong pathway, pero at the end point niya, kaya niyang i-detect ang level ng ating triglycerides. So first, again, there are several different enzyme reaction that can be used in all methods. Sa lahat ng methods na i-discuss natin later on, these are the first step that is common with all of these method. Again, confused kayo, no? Maraming method or enzymatic method to detect your triglycerides. Among all this method, lahat ng methods na to, ito talaga ang pinaka-umpisa nilang lahat. Ha? Again, that's very clear ha. This is the two first step that is common among these methods. First, anong nangyayari? Your triglyceride will be acted by your lipase, forming now your glycerol and your fatty acid. Excuse me. Then, your glycerol will be added by your ATP. Again, when you hear the word kinase, it has something to do with the transfer of phosphate group. Excuse me. So, ATP, remember, kinase, once you hear the word kinase, transfer of phosphate group. So, you transfer one phosphate to your glycerol, forming now your glycerophosphate. And then, since kumuha tayo ng phosphate from ATP, nagiging ADP na lang. So, we form the product of glycerophosphate and ADP. I hope this is very clear, ha? Again, this is the two most common step or the first two steps of the different methods of enzymatic methods of your triglycerides. Now, we will first discuss the first method. So, again, first two method, the same lamang. The first method, this is now the most commonly used method. Your glycerophosphate is then oxidized to dihydroxyacetone, and then your hydrogen peroxide in a glycerophosphate oxidase will be catalyzed. Again, kinuha natin yung glycerophosphate, we added oxygen. By the action of glycerophosphate oxidase, we form this product. And then, from your hydrogen peroxide, will be acted by this reagent, forming now by your action of your peroxidase, forming now your color dye complex, this dye complex. So that's the first enzymatic method. What is the next enzymatic method? The next enzymatic method, your again, same lang yung first two steps, same pa rin. Alternatively, your glycerophosphate can be measured in a reduced form of your nicotinamide adenine dinucleotide, your NOD-H, and is measured by your spectrophotometer set at 340 nanometer or in a diaphrase catalyzed reaction to form now a reaction product whose absorbance is measured at 500 nanometer. Dok, ano po bang ibig sabihin? No? Ganito lang, again, diba? Ulit-ulit sinasabi ko, first two step, similar lang, and ang nangyayari, your glycerophosphate will be acted by your glycerophosphate dehydrogenase with your oxidized nicotinamide adenine nucleotide, forming now your reduced nicotinamide adenine dinucleotide. Your reduced nicotinamide dinucleotide will be acted by your reagent tetrazolium di with the presence of your diaphrase, and therefore we will be able now to measure the level of your triglyceride. Ang pinaka-importante dito guys, no, yung mga enzyme reaction and what will be the end product. Next, the third method, other methods. This is the last method for your triglyceride, enzymatic method. Again, the same, nag-uumpisa pa rin sa ganitong reaction. And then, other method measures your ADP produced in the reaction. Kanina, glycerophosphate. Ngayon, ADP naman. Ang ADP naman will be acted by your by your pyruvate kinase with the presence of your phosphoenol pyruvate, forming now your, again, once you hear the word kinase, transfer of phosphate. So, tinanggalan natin ng phosphate, ang ating phosphoenol, transfer natin sa ating ADP, kaya nagiging ATP at nagiging pyruvate na lang siya. And then your pyruvate, with the action of your lactate dehydrogenase, we ended up with this product, and we were now able to detect the level of your triglyceride. Again, that's the basic methodology of your triglyceride. So, ito yung tatlo ha. These are the very basic enzymatic methods for your triglycerides. Now, let's proceed with the last laboratory method, your HDL cholesterol. Your HDL cholesterol separated by your chemical precipitation. So, in short, pag HDL test, gumagamit tayo ng chemical precipitation. So, there is a precipitating agents. The earliest one, heparin in combination with manganese to precipitate your ApoB containing lipoprotein. So, alternative, pwede natin gumamit ng sodium phosphotungstate with your magnesium. More specific, your dextran sulfate with magnesium. So later on guys, don't you worry, makikita natin yan sa components ng ating reagents sa ating package insert. I will explain that clearly later on. And however, there are interfering factors, your elevated triglyceride levels. And then, the clear supernate assay for your cholesterol content. So, pwede magagamit yung clear supernate for assay for your cholesterol content. We have also a gold standard or reference method for your HDL. Actually, this is a 3-step procedure. Yung 3-step procedure natin, we'll be using your ultracentrifugation to remove your VLDL. The next step is your heparin manganese precipitation to remove your LDL, and the analysis of your supernatant cholesterol by your Abel-Kendall assay. That's why ito yung 3-step procedure ha. Remember, ultracentrifugation, precipitation, and the analysis of your supernatant. And kindly identify what is the purpose of bakit tayo mag-ultracentrifugate para ma-remove ang VLDL, bakit tayo gumagamit ng heparin precipitation para remove your LDL, and then the purpose of your supernatant to detect your cholesterol. And the reference method, we have your, again, now, dito LDL na, kanina pala, HDL na yun. Now, we will proceed with your LDL cholesterol. So, the reference method will be your beta quantification, your electrophoretic migration, and your ultracentrifugation by chemical precipitation. But what is routinely done is by means of calculating your LDL using your Friday-Wald calculation. Ito na yung pinaka-common na ginagamit natin. You just have to compute your LDL. If you have already the levels of your HDL, alam mo yung total cholesterol natin, all you have to do is just subtract your values to your LDL. Makukuha mo na yung LDL values. So, tingnan natin sa formula. So, ito na yung tinatawag natin na Friday-Wald equation calculation to check the level of your LDL cholesterol. So, again, if you're going to get the SI unit, so di ba, ang SI unit natin is your millimole or standard unit, your millimole per liter. Conventional unit is your milligram per DL. If you want to get the SI unit, this will be the formula. Your total cholesterol subtracted by your HDL subtracted by your triglyceride over 2.175 to get now the level of your LDL in SI unit. If you want to get the level of your LDL at a conventional unit or milligrams per DL, ang formula natin is the same. Your total cholesterol subtracted by your HDL minus by your triglyceride over 5. Again, you have to divide first before subtracting. Baka usually ang mistakes ng mga student, total cholesterol minus HDL minus triglyceride over 2.175. You will get a wrong answer. You have to divide first your triglyceride to your 2.175 or 5 depending kung anong hinihingi. Actually, your triglyceride over 5 or triglyceride over 2.175, this is actually now your VLDL component. Do not be confused. This is actually your VLDL component. So you just basically subtract your total cholesterol minus HDL minus your VLDL component. Ito yung composition ng your VLDL. You divide your this is the reason why you divide your triglyceride. That's the VLDL component. Again, however, there is a limitation of your Friday-Wald equation. Not appropriate in samples with triglycerides of greater than 400 milligram per DL. Please remember that we cannot use your Friday-Wald equation to detect the level of your LDL once your triglyceride level is greater than 400 milligrams per DL. And with patients with suspected this beta lipoproteinemia, we cannot do or use this equation. Please remember that. So I have a sample quiz with you. Kindly compute for the LDL using your Friday-Wald equation using these given values. Again, compute for your LDL using your Friday-Wald equation using these values. So kindly comment down below. I-comment na lang dito below your answers. For those who will comment their answers, di ba nanalo ako? Natatawa talaga ako kasi, di ba? Nanalo ako sa, anong tawag ito? Nanalo ako sa paraffle nung kasinatian. So, I'll give that. Sige, ipaparaffle ko na lang sa inyo yung 300 pesos. So, for those student that will answer or comment down below, magko-comment down, dapat correct answer will have another chance of getting that 300 pesos. Sayang naman 300, pang-load nyo yan. Pang-load nyo na rin yun or pang-milk tea nyo na. Sige na. So, try your, of course, ang iba dyan, kakopy na lang ng answer. You try to solve. Try pa rin to solve para at least you can really test yourself na tama ba yung sagot nyo. Kahit magkukopya kayo dun, it's okay. Basta alam nyo paano i-compute, tama yung pagka-computation nyo. Okay? So, these are now the different reference ranges of your lipids for your adult. Total cholesterol with these values, HDL with these values, LDL and triglyceride. Again, magdadepende kasi yan sa different laboratory, no? Kung anong machine na ginamit nila, it's gonna be their specific range. Magdadepende talaga yan sa machine. But generally speaking, this is the reference range, normal reference range of your lipids. So now, ito na yung sinasabi natin. This is gonna be your package insert. So, Doc Von, what do you mean by your package insert? So, actually guys, this could be your, if this is a face-to-face na scenario or setup, this is really your activity in the laboratory. There should, konting pre-lab lang sa package insert. Wala na yung mga discussion actually, kaya dapat yung mga diniscuss ko kanina, dapat incorporated siya sa lecture. However, because of our current setup, so sinaperate namin yung mga lab discussion. So sinali ko na lang yung mga parts sa lecture na lab discussion. And then, supposedly dapat yung package insert lang talaga. Ito yung in a scenario of a face-to-face, no? Ito talaga yung activity natin. Magpe-pre-lab tayo sa package insert and then gagawin nyo yung activity. Doc, ano po ba itong package insert? Again, these are the different reagents. Sorry guys, ang example ko talaga ito, microalbumin. Wala talaga ako makita magandang picture sa mga cholesterol, etc. Pero technically speaking, ganito talaga yon. Ito yung mga natatanggap natin. So, ipakita ko lang ng, I'll make this bigger. Ayan. So, naka-box niyan siya guys, and then may mga nakalagay dyan. So, may makalagay, for example, STD, that's your standard, RGT, that's your reagent. Pero, sorry, wala man nakalagay dito. Pero usually nakakalagay dyan, naka-box na siya, and then nakalagay yung mga lot number. So, this is now your different reagents. Supposedly guys, no, kung face-to-face to, dito talaga yung matetest, magpa-practice kayo ng, ano tawag ito? Ng pipetting, dito sana kayo mahasa sa pipetting and as well as your venipuncture. As in like, no, ano yung mga activity dati pag third year, no, warag mga ma-anemic yun kag samot. You know what? At my time, lahi man namong style ato kay pag every week, pulihanay mi, dili siya for example ako, hindi siya pulihanay na next person like laboratory node, lahi among style ato that time. Isa ka person for that particular week, ikaw kung groupmates man kay usually ang groupings namin is the same lang yan for all the activities para yung mga gamit namin hindi na kami mahirapan kung magkuha ng gamit. So same group kami, hima, immunology, so same group jud mi ana. So kami nag-assign mi, sige for this week ikaw kung tanan na collection of blood sample ikaw ang kuhaan ha, for next week ikaw naman. Ako sa my time anemic mapugkuan kay after 1 week, no, kasi nagkahimatuman among mga kamot. Ay sige lang guys, you will still experience that though kasi nga nagsisimula naman tayo ng face to face with the interns, no, and supposedly hopefully by next year kayo naman, so you will really encounter this. Mapapractice nyo sana dito yung pipetting kasi kukuha kayo ng sample, itatransfer nyo sa cuvette, tapos yung venipuncture talaga, hahasa talaga kayo. Magkatawa gani ko guys, kaya kami when we collect blood sample, yung patient pa ang magreklamo, uy mali man na imong direction, direct pa side ka, ay ayun na, ang patient pa ang reklamo. Ay magkatawa jud ko, ay sige lang. So again, this is now your mga different reagents, no? So nakabutang na siya sa box. So lailahing box per test. For example, may cholesterol, may lipid, may HDL, may triglyceride. So lailahi na siya. And then may mga reagents na nakalagay. May label na siya, no, RGT for reagent, STD, hindi STD na sakit ha, STD for your standard, and etc. So depende, may mga instruction siya. Yung package insert na sinasabi ko guys is actually similar to your manual. Parang where you're just buying a new phone and then may manual na nakalabas. It's similar. The package insert there is actually the manual on how to perform the test or how to perform the procedure with all of these reagents given. That's the basic concept of package insert. Kaya sinasali namin to sa discussion kasi technically ito talagang ginagawa natin. So again, gets na natin yung package insert ha at yung mga reagents natin. And then, tingnan natin. So, ito yung mga package insert. So, ito for cholesterol. Sorry, maliit ha. May bigger picture. Pinapakita ko lang. So, dyan nakalagay lahat ng mga instruction, lahat ng dapat gagawin. So, technically speaking, manual talaga siya. Kumbaga, procedure lang. So, pinapakita ko lang. So, we will start now with your package insert of your cholesterol. So, we will be discussing how to perform the cholesterol test using the human color na reagent. So, again, excuse me. Ito na yung sinasabi natin na package insert. So, hopefully guys, before we discuss this, I hope that you have a better picture or copy, no? You can print it out or while listening to my lecture, dapat may copy kayo para it's easier for you to understand. Kasi alam ko, sobrang liit ng mga pictures nandito. Kasi nga, maliit din naman talaga yung package insert. So, I want you to print out or have a copy. Kung makita nyo man to, it's okay. Basta as long as nasusundan nyo ako para naiintindihan natin yung discussion natin for your package inserts. Again, unahin muna natin yung cholesterol. So, this is a cholesterol liquid color test using your CHOD-POP method. So, again, this is now your enzymatic colorimetric test for cholesterol with lipid clearing factor. So, this is now the test that is being employed. Enzymatic. Usually, enzymatic talaga tayo. So, enzymatic tayo ha. And then, this is the reference number. Yung nakalagay, just take note on that. Wala namang importante dyan. And then, this is now the method and the reaction principle. Again, familiar, right? The reaction principle that I discussed a while ago is similar. Ito na yun. The cholesterol is determined after enzymatic hydrolysis and oxidation. The indicator, quinoneamine, nabasa ko na siya. Quinoneamine is formed from hydrogen peroxide and 4-aminophenazone in the presence of your phenol and your peroxidase. So again, remember your indicator ha, your quinoneamine. So the reaction principle, your cholesterol plus your water. Okay, I don't need to explain the reaction principle anymore because I discussed this a while ago. Basta ang ating indicator for the presence of your cholesterol is your quinoneamine. No? It's very nice. Again, gets na natin. Next. Okay, ilipat ko lang kasi natatabunan siya. Ayan. May contents. So, ito na yung sinasabi ko, di ba? May mga bottles. Isang bottle for reagent, may bottle for standard. Ito na yung contents ng ating reagent. Yung standard, ito yung content. Content ng reagent, may phosphate buffer siya for the pH and different enzymes. Sino yung reagent natin? Nandito yung mga hinahanap natin na enzyme. Your phenol, your peroxidase, cholesterol esterase, cholesterol oxidase. Di ba? Kailangan dito for our reaction. So, nandyan sa ating reagent. So, kindly take note of these mga different reagent na no need to memorize. No need to memorize this mga 100 millimoles per liter. Anong equivalent? Ay guys, dati dyan. Ay, nako. Maalala dyan ako, gabi guys na. Dati ginamemorize ko na mo na siya, no? Kanagi, what's the point? As in, ginamemorize na kumugawas ko siya sa quiz na mo, guys. And, Adyo kong ganahe ato karang daghan kag no. For example, phenol 5 millimole per liter formula is 0.3. As in for me no, wala dyan siya point for me. So right now, I don't worry, do not memorize this one. Hindi ko talaga gets bakit yun lumalabas sa amin. Fill in the blanks pag na siya guys. As in makatawa mako ato ay pero again for me, di man siya jud kailangan na i-memorize kini mga. For me, ang mga important contents lang sa reagent, meron po siya mga enzymes doon, i-take note nyo lang, but kani mga 100 millimole per liter, mabuang po na estudyante memorize ang mga reagent, di man gani, ma-memorize siguro ni sa mga manufacturer, student na ba? Again, no need to memorize this one. Your cholesterol, content, okay, wala na yan. So, the reagent preparation, pag sinabi natin reagent preparation, kung yung reagent na ginawa natin, ready for use na ba? So, yung RGT, yan yung ibig sabihin na reagent, and your STD, yan yung ibig sabihin na standard, are ready for use. Reagent stability, the reagents are stable up to the given expiry date even after opening when stored at 2 to 8 degrees Celsius. The open reagent is stable for 2 weeks at 15 to 25 degrees Celsius. Contamination must be avoided. So that's your in terms of the storage and stability of your reagent. So Doc, ano mga specimen na pwede natin gamitin for this particular test? You can use your serum, your heparinase or your EDTA plasma. So again, these are the different specimen na pwede nating gamitin. Heparinase or your EDTA plasma. So note, lipemic specimen usually generate turbidity of the sample or reagent mixture which leads to a falsely elevated result. Remember, di ba, spectrophotometer ang magbabasa ng result natin. The more turbid ang ating specimen, the more increase yan, the more mas mataas ang absorbance na ma-generate ng ating spectrophotometer. Therefore, it will lead to a false elevated result. But using the cholesterol liquid color test avoids this falsely elevated result. Jar, wala advertise nila ilang reagent, no? The cholesterol liquid color test avoid this falsely elevated result through its built-in lipid clearing factor. Char, the lipid clearing factor clears up totally at turbidity caused by lipid specimen. So guys, ang product na to may lipid clearing factor. So pamain na lang po. Binasa ko siya para natatawa. Talagang nag-promote talaga sa maganda kasi may lipid clearing factor. Okay? Tapos na tayo sa methodology, principle. Nag-gets na natin yung mga reagent and your standard, yung specimen na gagamitin natin, and mga notes na dapat nating tandaan. So let's proceed now with the assay. So ito na yung assay na sinasabi natin. Paano ba natin gagawin? So pipetting scheme and the calculation. So simple lang. Sige, I know masyadong madami to kasi first time nyo itong ma-encounter. Don't worry, explain natin na maganda. Yung assay dito, ito yung i-input natin sa machine. Pag sinabi nating wavelength, you can use your 500 nanometer or 546 nanometer. Depende sa inyo kung anong pipiliin nyo. You would use 500 or 546. Then optical path, of course, hindi na naman natin yan. Naka-automatic na yan sa machine. Temperature, wala na tayo dyan. So optical path, temperature, wala na problema. Wavelength lang i-input natin. And the measurement should be against reagent blank. Against reagent blank. Only one reagent blank per series is required. So kahit madami kang ginawang test, okay lang na may reagent blank ikaw. Ano nga ang ibig sabihin ng reagent blank, ha? You're done with spectrophotometer with Sir Bong. I did listen to the discussion of Sir Bong. It was Sir Bong, no, it's very organized in discussion. I don't know, I really like how Sir Bong discusses his lecture. Sobrang, di ba, pag sinabi nating reagent blank, they are often used with the techniques such as this is your spectrophotometry to zero the instrument before measuring test sample and other blanks to make sure na naka-zero in ang ating result. So therefore, we will use your reagent blank before testing your sample or your standard. Again, that's why it should be reagent blank para ma-zero in muna ang ating result. So, pipetting scheme natin, mag-prepare tayo ng sample, standard, and reagent. Ha? Tingnan natin ha. Pipette into the cuvette, reagent blank, sample, and standard. So, tatlong cuvette ng ating i-prepare. But guys, technically, kung sa face-to-face, isa na ginaka-cuvette, ginahugas-hugasan na, puli-pulihanay lang dito siya, guys, promise. Kasi nga, you know what, your cuvette are very expensive. Kung magunit kami, guys, no? Magkurog-kurog good among kamot. Why? Because it's very expensive. It's 14,000. Ay, imagine 14,000 sa magkurog-kurog. Kana mabuyan lang niyo. Goodbye, gyud. Goodbye. Usahay na, nato isa ka grupo, nag-divide gid sila, kaya nakabuak man gid sila. No choice. So again, pipette into the cuvette, mag-prepare ka ng reagent blank and your sample and standard. So tatlo yan ha, preparation natin ha, tandaan. Pag sinabi natin reagent blank, paano tayo mag-prepare ng reagent blank? Walang i-add na sample and standard. Purely reagent lang, which is 1,000 UL. So again, reagent blank natin is purely 1,000 UL. Ang sample or standard natin, again, next tube natin, sample. Ang sample natin, kukuha tayo ng 10 UL and mag-add tayo ng 1,000 UL na reagent. Again, for the sample, kukuha lang ng 10 UL ng ating sample and mag-add ng reagent which is 1,000 UL. Next, third tube, your standard. Standard, paano nga ito kukuha ng standard? 10 UL plus 1,000 UL. Actually, same lang si sample is standard. 10 UL ng sample, 10 UL ng standard, haluan lang ng 1,000 UL. Guys ha, hindi sila as one ha. Separate yung sample, separate yung standard, separate yung reagent blank. So, tatlo ang ating cuvette or tubes. Reagent blank, sample, and standard. Then, what is the next step? Naka-prepare na po ako, Doc. May reagent blank na po based on the scheme and sample and standard. You mix, you incubate for 10 minutes. Of course, for the reagent blank, you do not need to do that kasi wala ka namang imimix, wala ka namang i-incubate kasi it's purely reagent. No need na kasi reagent blank lang naman. So, ang i-incubate natin, imimix is your sample and your standard. So, make sure lang na na-mix lang yung sample and standard with the reagent. Mix, incubate for 10 minutes at this temperature or 5 minutes at this temperature. Kung wala kang oras, 5 minutes lang, 37 degrees Celsius. Pero kung 10 minutes, dapat 20 to 25. So, magdedepende. Usually, wala man tayong incubator sa laboratory dati. As far as I remember, on my time, wala kaming incubators. Of course, dadudjud mi sa taas nga time na 10 minutes at room temperature. Kasi ang room temp is 20 to 25. Then, you measure now the absorbance of the sample and standard against the reagent block within 60 minutes. So, after incubating within 10 minutes or 5 minutes, dapat within 1 hour, makukuha na natin yung absorbance ng sample and your standard against reagent blank. Sige, para ma-imagine natin, lakihan natin ang picture na to. Ayan, sige, malaki na ang picture ha. Lakihan pa natin para makita pa talaga. Ayan, very good. So, this is now the diagram. Ito yung cuvette na sinasabi ko. So, tatlo din pinipare niya, no? Meron tayong for standard, meron po tayong for sample, meron tayong for reagent blank. Ito yung display button ng ating spectrophotometer. Nakalagay yung absorbance dito. Ito, absorbance. Tapos, nandito yung temp. Ano to? Percent temp. I don't know what's that. Walag na yan. And this is yung wavelength. So, dito nyo i-input yung wavelength. Kung ano yung requirement for our test. Diba? 546 or 5, ano yan? 546 or 500. So, depende sa anong gagamitin natin. So, i-input natin dito. And then, uunahin, ano nga, against reagent blank. I-zero in muna natin ang machine. So, ipapasok muna natin yung reagent blank. Ano gang laman ng reagent blank? 1,000 UL of your reagent. Ipapasok natin dyan, tapos i-close, then you read. Next, you read now your sample, then your standard. Either way, kahit standard or sample mauna. Then you read your standard, then you read your sample, i-click mo lang yung read, tapos lalabas na yung absorbance. So, usually naka-point yan. 0.100, 0.1234, 0.333. So, depende yan. Lalabas lang yan. So, basically, ganyan lang siya kasimple gawin. Yan. I hope na-imagine natin, no? I know, masyadong mahirap i-imagine, pero somehow, you're able to na-gets nyo man yung pipetting scheme. Now, how do we calculate for your cholesterol concentration? Ito, lakihan natin ha. Ibaliktad natin. How do we calculate for your cholesterol concentration? So, meron na tayong absorbance, diba? So, meron tayong absorbance ng sample. Unahin muna natin yung first calculation. Yung first calculation na to with factor. Meaning, absorbance lang ng sample ang kinuha natin. Hindi tayo kumuha ng absorbance ng standard. Pero, ang ginawa natin kanina, wow, ginawa talaga kanina. Ang ginawa natin kanina, kumuha tayo ng absorbance ng sample and standard. Pero for the first calculation, you can already get the cholesterol concentration if kahit wala ng absorbance ng sample. Paano siya kino-compute? So, i-identify mo muna kung anong ginamit mo na wavelength. Kung, Doc, gumamit ako ng 500 nanometer. Okay, ito na. 500 nanometer, this one. Ito yung ginamit mo na wavelength. So, ang concentration ng ating cholesterol, either way, mamili ka. Ang hinahanap ko, Doc, gusto ko in conventional, di ba? Conventional is milligram per DL. So, paano natin i-compute? 500 nanometer ginamit sa test. Conventional ang gusto kong makuha na result. So, 553 times absorbance of your sample. Pag lumabas ng absorbance ng sample is 0.500. So basically, ang gagawin mo lang is 0.500 times 553, meron ka ng result ng cholesterol. This is now referring to your with factor. Again ha, pero ang ginawa natin, may sample tayo and may standard. And most of the time, ito talaga ang ginagamit natin, yung may standard. Yung may standard. Hindi ako nakaka-encounter dati na with factor lang ang ginagamit namin. Kasi nga, most of the time, yung mga reagents naman natin, mayroon ng standard. So, ito yung usual na ginagamit natin, yung with standard. Paano naman natin makuha yung cholesterol concentration? Gamit ang with standard. So, ang formula natin, hanapin muna natin whether anong gusto natin, milligrams per DL or millimole. Conventional. Doc, gusto ko naman SI unit. Sige, SI unit, millimoles per liter. So, ang factor na gagamitin natin is 5.17, imumultiply mo lang sa, first, i-divide mo muna yung sample, absorbance ng sample, for example, 0.500 over 0.200, ang standard absorbance is 0.200. Then, the answer of that, imumultiply natin sa factor na 5.17, and that will get you now the cholesterol concentration. Diba? Mas madali compared sa lab math, guys. Mo na gid ni atong math sa clinical chemistry. Even maabot mo clinical chemistry to, ingani lang ka-simple. Wala na gito mga like convert, blah, 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 blah. All you have to do is remember the factors of your cholesterol pag SI or pag conventional or pag SI. Usually talaga with standard talaga ang ginagamit natin. Pero ha, remember ha, pag wala akong binigay na standard, anong formula ang gagamitin natin? Syempre, itong with factor, and you identify what is the wavelength kung 546 or 5. Of course, given naman na, given kung alam mo, magbuot-buot mo kung 546 ang wavelength na ginamit ko. Of course, hindi naman. Sige lang, meron akong example na quiz dito. Okay? I hope that is very clear lang ha. Sige, tingnan natin. Ito, so, meron tayong example. So, upon doing your spectrophotometry, you get the absorbance of your sample, which is 0.1250, and absorbance of your standard, which is 0.1370. Question, anong gagamitin natin na formula? Katong with factor or with standard? Syempre, natin standard. Gamitin na to ang with standard. And again, most of the time, with standard, dito itong ginagamit. The question is, calculate the concentration in conventional unit. Ay, conventional. Kanibang milligram or millimole? Convention. Itong milligram per DL. So, ang gagamitin natin na factor is 200. And then, i-input mo lang yung sample. Yung sample natin is 0.1250 over 0.1370. Then, i-divide mo ni, i-multiply sa 200, you get now the concentration of 182.48. Diba? Very easy na lang. Ay, this is mo lagi pinakasayon-sayon na ginatong lab math ani, diba? Mas easier pa ni siya compared sa lab math. That's it. Pero doc, what if ang gusto na ko SI? So, syempre, hindi 200 nakabutang diri. You just put 5.17 and then you multiply this to this answer. Ha? That's the easy way na to compute your lipids. Very good. And also, there are so many things to consider. Performance characteristic, linearity. The test is linear up to a cholesterol concentration of 750 milligrams per DL or 19.3. Dilute sample with a higher concentration. Again, ha? Up to linear lang siya, up to cholesterol of 750 or 19.3. Anong ibig sabihin na linear siya, doc? Meaning, kung ano talaga ang computation mo, that is really the value, the real value. However, if it is more than 750 or 19.3 millimoles per liter, kailangan mo pang i-dilute ang sample with a higher cholesterol concentration, 1:2 with physiological saline, and repeat the determination and multiply the result by 3. Again ha, emphasize na ito ha, emphasize natin kasi baka pag-check nyo sa result, hala, naabot siya 800 doc, akong computation 800. For example, dali, ang naabot sa akong concentration is 800, i-release na ito ng result, dili. Of course, you are not going to release the result because remember, the test is linear only up to 750. Pag lumagpas ng 750, you have to dilute the sample, by this concentration with your physiologic saline and repeat the test. I-repeat mo naman yung absorbance. So, mag-test gihapon ka the same with what you do, and then you multiply the result by 3. That's how you compute it. I hope that's very clear, ha? Emphasize yun ako ni. Clinical interpretation, suspect over 220 or elevated if it's already 260. Suspect na taas, mayroon siyang hypercholesterolemia if it's already 220. It's already, hindi na siya suspected, mayroon na talaga siyang hypercholesterolemia pag elevated or greater than 260 mg per DL. That's how you interpret that one. Okay? For the quality control, all control sera with values determined by this method may be employed. We recommend the use of animal serum based of your humatrol or human-based serodose quality control. Ay, nakakatawa ko guys. Guys, dati sa mga quiz mo gawas kini mga humatrol, serodose, kung anong ginamit na quality control. Ay, ambot, kung pagawasan ko pa ba na sa inyo? O, gini, ay, malalagid ako ng mga terminology na humatrol, serodose, fill in the blanks, maguto dati sa mga. Karagay, ang papers namin is a long paper, tapos na-printed siya, tapos fill in the blanks, kita guys, so, ina-enumerate, anong quality control, humatrol, and serodose. Automation, and note, the test is not influenced by hemoglobin values of 200 mg or 500 mg DL. By bilirubin of up to 5 mg per DL. So remember that, ha, not influence. Therefore, pag it's more than 200 mg or more than 5 mg for bilirubin, it will now interfere your result. Ano nga mangyayari sa or di ba sinabi ko kanina, anong effect ng bilirubin? It will interfere with your hydrogen peroxide, causing now a false decrease of your result. So again, remember these values also, ha, for your hemoglobin and your bilirubin. Pag normal ang hemoglobin ng pasyente natin, ayos lang. Pag normal ang bilirubin or mababa from 5, ayos lang. But more than 200 or more than 5, it's not okay. The reagent contain your sodium acid as preservative. Do not swallow, avoid contact with skin and mucous membrane. Lumalabas dito dati, anong ginagamit na preservative? O ha, may clue na kayo sa mga usual na nilalabas. Pero for me, it's really the application of the result. Yun yung pinaka-importante, yung marunong kayong mag-compute. Okay? I guess we're done with the cholesterol. Ang haba ng ating discussion. Now, let's proceed with the package insert of your HDL. At least ngayon, kanina sa cholesterol alone, gets na natin, it's easier na lang to understand this one. For your HDL cholesterol, so again, precipitant and standard for use with cholesterol liquid color test kit. So anong methodology natin? The chylomicrons, VLDL and LDL are precipitated by the addition of your phosphotoxic acid and magnesium chloride. Again, remember, anong precipitant na ginamit natin for this test? Phosphotoxic acid and magnesium chloride. After centrifugation, the supernatant fluid contains the HDL, which is assayed for HDL cholesterol with your cholesterol liquid color test kit. So, ginagamit natin yung supernatant fluid. So, again, anong mga bottles na nakapasok sa ating reagent na ginagamit? Meron tayong PREC and STD. Ano nga yung STD? That is standard. Ano ang PREC? PREC is precipitant. Anong composition ng precipitant for HDL cholesterol? Your phosphotoxic acid and magnesium chloride. Standard natin has your cholesterol. Reagent preparation, precipitant for macro assay is PREC-A, used undiluted precipitant. Reagent preparation, ito, same man pala, sorry, dito na tayo. Ito. Reagent preparation for macro assay, PREC-A. Precipitant for semi-macro assay is PREC-B. So again, Doc, anong difference ng macro assay sa semi-macro assay? So yan, magdedepende yan. Pag sinabi nating macro assay, mas malaki ang volume na gagamitin natin. When we use the semi-macro assay, ang volume ng sample na gagamitin natin and also by the reagent is maliit lamang. Later on, magigets natin sa ating instruction dito nakalagay. Sige lang. Kasi may idea kayo ha, pag macro, ang ginagamit natin is your PREC-A or precipitant A. Precipitant for semi-macro assay, PREC-B. Again, pag PREC-A, automatically use the undiluted precipitant. So, yung nakalagay na reagent na may prec, automatic yan na yung gagamitin kasi that's for macro assay. Pero, pag semi-macro assay ang gagamitin natin, anong mangyayari? Dilute the contents of one bottle, your prec, of course, the same prec na ginamit natin sa macro assay with 20 ml distilled water, or dilute 4 parts of the bottle with 1 part of distilled water. Again, basically speaking, similar lang sila. Kaya lang, dilute natin yung semi-micro assay. Again, macro assay, prec A, semi-micro, prec B. Magdedepende kung ano ang gagamitin natin. Kung gagamitin naman natin macro assay or semi-micro. Ang advantage nito is that kung kulang ka ng sample, anong gagamitin mo? Semi-micro or macro? Of course, gagamitin mo ng semi-micro kasi nga konting sample lang ang gagamitin. STD or your standard is ready for use and can directly be employed in the test. No precipitation is required. The factor in the calculation formula comprises the dilution ratio. Again, yung standard is ready for use. That's the basic na gustong ipaalam ng package insert nito. Automatically, ano yung standard? That's it. Stability, you can read on this one. Specimen, serum, heparinase, or your LDL plasma. So this is now the procedure na ating gagamitin. First is you do your precipitation. Ano nga ang precipitant na ginamit natin? Phosphotungstic and, diba nakalimutan ko din? Phosphotungstic and magnesium chloride. Yan yung precipitant na ginamit natin. Ha? Remember that. Now, sige, Doc Von, anong gagamitin natin? Sige, daghan matag sample. Macro assay akong buhaton. So either way, hindi mo pwede pagsabayan, maggawa kong macro assay sa may micro. No, pili ka lang ng isa kasi sayang yung sample natin, sayang ating mga reagents. So, for example, macro ang gagamitin natin for this test. Anong gagamitin? Prec A or Prec B? Your Prec A. Your Prec A. Pag sinabing Prec A, automatically na yung precipitant natin, kukuha ka ng 1,000 UL ng precipitant and 500 UL ng sample. That's it. Pag semi-micro ang method, anong gagamitin? Yung sample natin, 200 UL lang. Prec B ang gagamitin. Ano nga ang Prec B? Yung may dilution pa. Kailangan mo pang i-dilute. Unlike sa Prec A, automatically, yan na yung precipitant. No need to dilute. I hope that's clear, ha? Then, what will you do? Mix well, incubate for 10 minutes at room temperature, centrifuge for at least 2 minutes at 10,000 G, alternatively for 10 minutes at 4,000 G. So, after centrifugation, separate the clear supernatant. Your supernatant, yung nasa-separate natin after centrifugation from the precipitate within 1 hour. Now, you will determine using your cholesterol liquid color reagent para ma-detect yung ating HDL. So, tapos na tayo dyan. We will now proceed with the cholesterol determination of your HDL. So, pipette into cuvettes. Again, same pa rin. Ang kinag-iba lang sa procedure natin kanina is that walang precipitation yung first procedure. The next package insert na diniscuss natin, may precipitation na. And then, we have another procedure. So, you will prepare your reagent blank, your standard, and your sample. Composition ng reagent blank, distilled water, 100 UL, and your reagent. Your standard, 100 UL ng standard, and your reagent is 1,000 UL. And for your sample, yung sample dito referring to the HDL supernatant. Hindi siya nagre-refer sa hindi siya nagre-refer sa ating serum. Yung nagre-refer sa ating HDL supernatant, which is 1,000 UL. But remember, kanina, pinacentrifuge natin, tapos may precipitate sa ilalim, and yung may clear supernatant, yan yung ginamit natin sa sample, hindi yung from the serum pa kanina. Kaya, I hope that's clear. Then, for the sample, again, HDL supernatant, 100 UL, and the reagent of 1,000 UL. You mix, incubate for 5 minutes at 37, at 20 to 25, and measure the absorbance of the sample and standard respectively against the reagent blank within 60 minutes. The same kanina. Reagent blank una, tapos sample and standard, and you will now get your absorbance. Very basic. Now the question, calculation for the HDL cholesterol concentration with factor. Pag factor lang, wala na tayong absorbance ng ating standard. Ang gagawin lang natin is i-multiply automatically. For example, ang ginamit natin is 546. Tapos, Doc, anong ginamit natin? Macro or semi-micro? For example, macro ang ginamit natin. Tapos, ang wavelength na ginamit is 546. Tapos, gusto ko is in SI unit. So, ang factor natin is 7.09. So, 7.09, i-multiply natin sa absorbance ng sample. That's gonna be the concentration of your HDL. I hope that's clear. Actually, same lang yun kanina. Pag walang computation ng standard. Pero most of the time, meron talaga tayong standard na kinukuha. So therefore, ito yung calculation na ating gagamitin. Again, sakit ng boses ko, parang sumisigaw kasi ako eh. Ewan ko talaga, parang again, I hope that's clear ha. With factor lang ito pag walang standard. Pero pag may standard na, ito na yung mga formula na gagamitin natin. Again, identify. Sige, ang ginamit natin semi-micro method. Doc, gusto ko SI unit. Sige, SI unit. Ito. Anong factor? 4.52. Absorbance of the sample divided by absorbance of the standard. You multiply that 4 by 4.52. That's how you get your HDL cholesterol. Very good. Ito yung Friday-Wald calculation natin kanina. You already done discussed that for your LDL cholesterol concentration using your Friday-Wald formula. We already explained that a while ago. Sige, example. Sige, ang binigay natin is absorbance ng absorbance ay with standard ha, kasi may standard tayo. Ginamit natin is with standard. Sige guys, baka ma-confuse Doc Von, kailangan namin to i-memorize yung mga 150, 3.87, 4.52, 175. Sige na, you don't need to memorize that. Sige, I'll give that as ang tawag to. Sorry, I'm lost of words. Sige, I will not make you na i-memorize. You have to memorize it. No need na I'll give or provide this during the examination kasi I don't find it na parang essential man na kailangan i-memorize ni mga yaning value. No need na. Kasi in reality, no, if you are working as medtech, naman kay manual na pwede kopyahan. Hindi ba nato na memorize tanan, no? So, for me, it's not really necessary to memorize these mga important factors. I want you, ang pinaka-importante talaga is you know how to solve and you know how to determine what factor is going to be used. Of course, I'll provide this data or information ng mga factors. Okay? Sige, example, absorbance ng standard natin is 0.3650. Absorbance ng sample natin is 0.1350. Using semi-micro method, calculate the concentration in SI unit of your female patient. So, semi-micro, ito, semi-micro, SI unit, itong millimole. So, anong factor? 4.52. 4.52, i-divide muna bago i-multiply. So, 4.52, and you get the concentration of 1.67 millimoles per liter. Again, 2 decimal places pa rin tayo, ha? Round off to 2 decimal places. So, your concentration is 1.67. So, Doc Von, paano natin yan mai-interpret? Remember, to interpret that one, identify muna anong patient natin. Babae, lalaki, female patient. So, tingnan natin, female, woman. Ano yung value natin in SI or conventional? It is in SI unit. Ano yung result natin? Hindi ko pa na-memorize. It's 1.67. So therefore, 1.67, it's already standard risk level. So the patient is already at risk. May risk level na siya. But if it's more than 1.68, it's a favorable level. Remember your HDL, the greater the HDL, that is now better for our heart. Kasi nga, HDL is the good cholesterol. Kaya gusto natin ang mas mataas na result. It's a prognostically favorable. Pag mababa ang HDL, it's a great risk indicator. Pero for our patient, nasa boundary pa siya, no? 1.67 standard risk level. So, please remember that. Again, kindly take note, linearity. Meron bang linearity? Okay, wala namang linearity. Dito, take note of the supernatant is not clear, high triglyceride level. You have to dilute the sample before precipitation. So take note of this and multiply the result by 2. For high concentration of ascorbic acid, will give a lower values. Remember that we already know what the effect of your ascorbic acid. Hemoglobin level higher than 100 and bilirubin level higher than 10 will interfere the result. So kindly take note on this one. Sakit na ng boses ko. Again, last package insert kasi nga mahaba ang lipids, no? If face-to-face to siya, guys, per activity, isa-isa tayo, isa-isa. So, for triglyceride, the methodology, the triglyceride I determined after your enzymatic hydrolysis with your lipases, and the indicator is your quinine-imine formed from your hydrogen peroxide, this product under the influence of your peroxidase. Again, no need to discuss na to kasi discuss natin to a while ago. And kindly remember the contents, do not memorize these values, just familiarize lang these important contents. Reagent stability, okay? You can take note on this na lang ha, you can read on that. Specimen, almost same lang man, serum, heparinized plasma, or EDTA plasma, serum, heparinized plasma, or EDTA plasma. Again, still nag-promote na naman ang ating brand. The test, Monotest avoids this false elevated result through its built-in lipid clearing factor. The LCF clears up totally a turbidity caused by lipemic specimen. Wow, promote pa. Again, we already know, alam nyo na ha, paano the wavelength, take note of the wavelength, same pa rin against reagent blank. Again, I don't need to discuss this or elaborate this further. You already know how to compute for the reagent blank, sample, and standard, and the formula. So, for the calculation of the triglyceride, the same na lang po tayo. Identify kung anong factor, sample, standard, sample, or standard. And for the linearity, kindly take note lang ha, ito. Sorry guys, I will not dealt with this anymore kasi alam nyo naman yung mga linearity, kung kailan mag-dilute or not, and the clinical interpretation. Okay, very good. Sobrang dami ng ating na-discuss. I guess that ends my lecture video. We were able to discuss the different methods and somehow a overview of what dapat ginawa natin sa laboratory if this is a face-to-face setup. At least you have now the idea kung anong ginagawa natin. So right now, if you have any concern or questions regarding my discussion, please do not hesitate to PM me or post to the content forum. Again, emphasize namin, ipopost natin sa content forum. Thank you everyone. Hindi ko talaga makakalimutan yung mag-comment down below. Promise, ipaparaffle ko yun sa mga nagsagot, yung 300. Sayang din naman yun. So thank you everyone. God bless you. Have a great day. Happy Aral everyone.